Hello, my name is Richard,
My name's Hazel.
And I'm Sean.
and today our presentation is going to be talking about hypertension. And hypertension can be defined as the elevation of blood pressure that can result in cardiovascular damage or other harmful damage to the body. The hypertension threshold is usually 140 mmHg of systolic blood pressure and or 90 diastolic blood pressure. Um, Two can be confirmed on two separate occasions, or if the person is on antihypertensive medication, they can be defined as hypertensive.
So just show an overview of the pathophysiology. Blood pressure is the cardiac output, or the how much blood the heart's pumping, and multiplied by the total peripheral resistance, which is mostly contributed by the radius of the blood vessel. Therefore, hypertension can be caused by increase in cardiac output and or total peripheral resistance. But usually hypertension is a result of normal cardiac output but increased in total peripheral resistance. So two ways to develop hypertension is one primary hypertension where the cause is unknown because there's multiple factors that contribute to the hypertension. And this can include age, smoking, genetics, um, and this is 90% of the cases of hypertension. But another case for hypertension is secondary hypertension, where the known cause is usually renal disease or kidney disease. So regardless of the cause, long-term hypertension damages the endothelium of the blood vessels, which can predispose an individual to atherosclerosis or hardening of the arteries. And this can lead to stroke, renal failure, or even death. It can also cause left ventricular hypertrophy, where the enlarged heart causes the heart to work harder and then cause possible heart failure. Oh, so for disease free, so a little bit on the statistics. Over one third of adult Americans have hypertension. 30% are pre-hypertensive, and the chances increase with age. And the lifetime risk of developing hypertension is 90%. And it also hypertension also depends on your ethnic population. Non-Hispanic whites, 20 years older, have 33% are hypertensive, and for non-Hispanic blacks under 20 years old, have 43% hypertension. And Mexican Americans 20 years old have 27.8 hypertension. And from the 1997 to 2007 death rate of hypertension, it has increased by 9%, and the actual number of deaths increased 36%, about 36%.
All right, so with that information, we also found some correlations to do that affect hypertension. Um, One that we found was income. Usually, with lower income residents, they're more likely to develop hypertension just because of junk food availability, how cheap junk food is, and pretty much like grocery lists. A lot of people do not like to cook their own food. Another correlation that we found was culture. Like what Sean reiterated was there's different races. Certain races do have or are more at risk for hypertension. Population, depending on um, who you associate yourself with. Obviously, jocks um, would probably have a lower risk of hypertension comparing to like people who play a lot of video games or something. And then location of living. As we see in a lot of the maps of the United States, a lot of the South is at more risk of hypertension comparing to other states such as like Colorado. And then also with technology, pretty much technological advances pretty much affect physical activity. Uh, a lot of people want to play more video games rather than go outside. pretty much.
All right. So this table represents the adults who had hypertension in the U.S. Between the years of 2009 and 2010. The graph is broken up into age, gender, sex, and ethnicity for a clear classification of those who are at a higher risk. And we could also see that awareness and treatment is closely aligned. So that could lead to a better standing of more people are being treated throughout the years between 2009 and 2010. So there, the numbers are right here, a percent, and these are the ages right here. So for this graph, it shows that the deaths of diseases of the heart, which is hypertension, between 1900 to 2011, and from the table, it was 2009 to 2010. So if we closely correlate it, we would be right here, and this is where the number of deaths for hypertension is declining, which shows that we are on the right path compared to the highest point, which is 1990. So some risk factors that were also on the graph was age, but also there's genetics, excessive alcohol consumption, excessive salt intake, obesity, physical inactivity, and renal disease.
All right. Here are the diagnoses for blood pressure or for hypertension. A person that has normal blood pressure is defined as a person who has 120 systolic or 80 diastolic. Prehypertension it ranges from 120 to 139 systolic and 80 to 89 diastolic. Anything over that, you're in the hypertension zone, pretty much. For stage one, it's defined as 140 to 159 systolic, 90 to 99 diastolic. And then for stage two, it's pretty much anything over 159, which is 160 plus systolic and 100 plus diastolic. Um, a way to test for hypertension is pretty much a blood pressure cuff or a sphygmomanometer. Um, you could find this readily at obviously the doctor or pretty much any sort of like pharmacy. And usually, if for the ages 18 to 49, you would want to get your blood pressure checked twice a year.
So the symptoms of hypertension is it's often thought as a silent killer because there's no specific symptoms felt by high blood pressure. And these specific symptoms may be linked to elevated blood pressure, such as headaches, dizziness, blurred vision, optimally in the morning, epistaxis, which is nosebleeds, and hematuria, that is red blood cells in the urine because of the lack of the breakdown of salt in your kidneys.
All right, so here's some recommendations for exercise according to our case study. For dynamic aerobic exercise training, we would want to recommend that because it improves overall health and decreases cardiovascular risks. Um, a way it does that is it will decrease vascular resistance due to the change of the renin angiotensin activity, which vasoconstricts blood vessels and increases blood pressure. For resistance training, pretty much any moderate intensity supplemented with aerobic exercise will help decrease blood pressure and just for general overall physical fitness. Um, for the recommendations, yeah, exercise is the key uh, to help prevent hypertension and to help treat it and control it. And aerobic endurance training is recommended because according to the study, it had it was scientifically proven um, to help with hypertension comparing to resistance training. And then just going over just what I just said on the recent slide, with exercise, it'll help reduce triglycerides. It'll help reduce glucose, and with less glucose in the bloodstream, it'll allow more blood flow throughout the body. It'll help with insulin levels. With less glucose in the bloodstream, insulin will not be suppressed in the body, and the body will start utilizing insulin. And when insulin is utilized, it'll help bring in glucose into the cell where it can be burned or where it can be used as energy. And with exercise, it'll also increase HDL levels. And with elevated HDL, it'll help extract cholesterol out of the body. And according to the study, the findings are compatible with overall improvement of cardiovascular risk, as it helps reduce stroke mortality, and it'll help reduce the attributes to coronary heart disease.
So for aerobic exercise, we're following the ACSM recommendations, where the frequency we'd want to do every day if possible. Intensity, we would like to do moderate intensity of around 40 to 60% of VO2 reserve, or RP of 6. And the way they choose that is if you can ask them if they have if they're using beta blockers. If they're using beta blockers, we know that it can reduce blood pressure and reduce the heart rate, so it wouldn't be ideal to use the heart rate VO2 reserve, because their heart rate can't go too high. So an RPE might be a better indicator for intensity levels. And for time, we want to do around 30 to 60 minutes, and it can be done in intervals. The reason for intervals is because they might not be able to do 30 minutes to 60 minutes right away, so it can be broken down into smaller intervals to make sure you get in to get in the recommended minutes. And the type of exercise is going to be aerobics, such as treadmill, walking, or biking. And one way to pick which one is best preferable is also taking into consideration what they like to do. For example, if they're obese, they might find walking a little bit harder, so they might want to bike because it's a little bit more easier and they can do it longer, which means they can expend more calories. And for resistance exercise, we want to do 2 to 3 days a week with at least 48 hours of rest between muscle groups used. Intensity, we want to do around 40 to 60% of 1 rep max, or we can consider this endurance training. We want to do endurance training because it expends more calories, which can decrease body fat composition, which is a risk factor for hypertension. And we want to do at least one set of 8 to 15 repetitions of 8 different exercises using big muscle groups. Also, individuals should seek drug therapy for resting blood pressures over 180 over 110 millimeters of mercury before exercise, and should not exercise on days where blood pressure is over 200 to 110 millimeters of mercury. Also, with resistance exercise, the reason why we don't want to go into higher intensities is to avoid increases in blood pressure. And with higher intensities, we tend to do a technique also known as the Valsalva maneuver, where we hold our breath, and that could spike our blood pressure even higher. So we want to try to avoid that.
Okay, so to summarize our presentation, again, hypertension is considered having high blood pressure, at least 140 over 90 millimeters mercury, right? Which can cause cardiovascular damage. It can be caused by multiple factors such as obesity, smoking, excess alcohol consumption, or genetics. Or it can be caused by renal disease, which alters sodium control and blood volume. And lastly, blood pressure can be decreased through aerobic exercise by decreasing vasoconstriction of blood vessels of the autonomic nervous system. Thank you.
Thanks.